Hi, Ramina. Um, so I'm Toh Wong. I'm a GP in Exeter, GP trainer to registrars, foundation year doctors, also council member of the College of Medicine and Integrated Health, uh, and recently also a council member of the British Medical Acupuncture Society. And I also got to know about nutrition and the people at the ANP from organizing a conference called the Integrative Health Convention. We hold it once a year in London, and there are lots of different types of complementary therapies and supplementary therapies, and with complementary and conventional therapists together, talking about everyone finding out about what each other does, and then a way to connect and share and learn from each other. So my story goes that when I became a GP, I didn't really know what I was getting myself into. So we weren't trained quite for things like muscular problems, nutritional problems, or which people were asking about, and we weren't even trained for depression. So one of the things I wanted to learn very quickly was I wanted to learn how to manage the aches and pains, because that makes up about 20 to 25% of all that we see. So then I went to learn some acupuncture. It was back in 2008. And then later on, I learned about NLP. As I was learning about CBT, that didn't quite suit me, and I don't think it suits a lot of people. So I went to look into NLP, and that suited me well. They all talk about the same thing. They all talk about, and then from there, I went to doing a bit of hypnosis. But that really only happened when I developed quite a bad Bell's palsy back in 2015, and it was really severe in the sense that it never got better. After a month, most 90 to 95% of Bell's palsy will improve. Mine didn't, and I was paralyzed. And so then the whole of medicine didn't give me much hope. All the doctors said that's tough. It's going to be how it is. We can't do anything to help you. They didn't even say you might get somebody back. They said, well, if it hasn't come back by now, it's never going to come back. Tough luck. And that sort of started my journey into other things. By accident, I stumbled upon hypnosis, and from there, my face got better. But that isn't quite, but that sort of, and then that's when I studied hypnosis and started looking into complementary therapy, because I thought, what don't we know here? But the other thing that happened was one of the functions of the facial nerve is that it supplies the 2/3 of your tongue for taste, or one side of your tongue for taste, whichever side it was affected. For me, it was my left side. But what I didn't know was that the quality of the sweetness of your taste, you need your whole tongue. I never knew that. And so nothing tasted the way it should have. And so then I had this profound experience whereby I hated chocolate. I used to love chocolate, but it tasted like butter. And if you were to lose all your memories about chocolate, and if someone came from somewhere where they've never tasted chocolate before and they put it in their mouths, and they couldn't taste that it was sweet, I can tell you they will spit it back out again, because that's what I felt like doing. And I couldn't believe I was putting this into my mouth. And so I stopped eating all these snacks and all these things, because every time I put it in my mouth, all my wonderful memories I was losing them. So and then what I found out was I could smell it and have the same memories, but as long as I didn't taste it, I could keep my memories. So I lost a lot of weight. I lost 3 inches around my waist. I'm not a big person. I didn't have much to lose. I went from 65 to 60 kilos, which is not a lot, but I lost 3 inches around my waist. During that time, I couldn't taste anything very well, but I could taste spicy food. And so I had very, very spicy food. And the problem with spicy food is that it upset my tummy. But I didn't know that, because I was such a good doctor. I told myself they were gallstones, because it was fatty foods as well. So I went and had a scan, all ready to have an operation for gallstones. And then I found out it wasn't gallstones, but that wasn't the point. As I went for the operation, the scan, the ultrasound scan, the person was gobsmacked. She said, "You've got no visceral fat. There's no internal body fat." I said, "Yeah, but I'm sure that's what it's." I said, "Isn't that what it's supposed to be?" She goes, "No, I never, ever see this." I said, "Well," I said, "What do you mean?" I said, She goes, everyone she says, everyone I see, day in, day out, they have fat around all their organs. And what do we know about visceral fat? We know visceral fat directly corresponds to fat in your arteries. And it's linked to, but how do we get rid of the visceral fat? How can we reverse the fat in the arteries? How can we reverse the fat in your tummy? And it seems that it's all to do with nutrition. And you know, that is, if not the holy grail of things. So I started to look into nutrition, and I knew, and one of the things, you know, that really these days, you know, I realized, because I was talking to Layla Al-Malden about the microbiome and things like that. And the microbiome is a fascinating thing, because we now know it exists. We know it's more than what we knew before. No one ever taught us about this. But one of my patients, and I learned so many lessons from my patients, not just myself. One of my patients, I've known him, so I've been a GP for more than 10 years. So I know all these people for more than 10 years. He nearly died of C. diff, Clostridium difficile infection. So people close down wards in the hospital because this overgrowth of bacteria in your gut, usually because we've given them antibiotics, and it coats your gut yellow. It's disgusting. You get this profuse yellow diarrhea. And with the antibiotics that we have, it's only antibiotics, medical therapy is apparently only about 60% effective, which means if it's resistant to our antibiotics, people are going to die. They're going to have this diarrhea. It stinks. They can't go anywhere. It's just pouring out of them, and eventually they may die. And my patient was there already with lots of medical problems, and he's only about my age, you know, maybe 40 years old. And he's dying. And then one of the doctors goes, we're going to do some fecal transplants. Now, fecal transplants, you know, sounds disgusting, doesn't it? And it's not just a small amount. We're talking about like 250 mils of feces, you know, depending on where you go. But quite a lot of, and so they wash it down, they put it in your gut. So different places do it differently. You can put it through the bottom all the way to the top. Flush it in. You can take capsules. But over here in the local hospital, what they do, put down is a nasogastric tube into your gut, and they pour this feces in. Right? But what happens is 95% of the time, according to the data that I've read, and if you look online, within 48 hours, this yellow gut is pink. It's red. It's back to normal again. And so my patient walked out 48 hours. He was dying to 48 hours later, he walked out of hospital. So I gave a talk to the FHT about referrals to GPs, which I'll share with you and your colleagues. I'll put it online, and then I'll give you the address. So one of the things I say is, first of all, don't send leaflets through to people and to doctors, because we get a lot of junk mail, mainly from drug companies, and we don't need any more from nutritional therapists. So everything goes straight into the bin. So don't do that. If anything, you need to see someone face to face and treat, and then let them realize that, you know, what we found out is that from doing organizing a conference, meeting lots and lots of therapists. If you look online and you put Dr. Toh Wong or the Integrative Health Convention on there, we've got over 50 interviews, if not more, videos of us talking to complementary therapists. And not a single one of the people that we've talked to is there for himself. Everyone's there to help other people. And so doctors are there too, but they just don't understand that there's this, I think we don't understand, there's this whole world out there where people are actually actively wanting to help other people. And so communicating that is really important. How do you communicate that? The thing is, these qualifications, we're not huge on your qualifications because we don't know what they mean, and you know, not really. Most complementary therapists are not statutorily regulated, which then has a bit of suspicion around from the medical profession, because if you're not statutorily regulated, what does that mean? But then, you know, we don't really know that much about osteopathy and chiropractors who have statutory regulation. So So I think it's about knowing what you do and what your training is, um, and how long. We appreciate the length of time someone spends training. Uh, that we do appreciate. But the other thing that to do is to talk, like I said, to talk in the same language as us. I mean, to say things like, to start to tell them about things like the fecal transplants, because we know about fecal transplants, we know they exist, but we don't. And if you show them, if you show doctors a photo, this is C. diff infection of your gut. I mean, we all know how the gut looks like inside. We've all seen it. And when you see it's not pink and it's yellow, and then 48 hours later it's pink. In every study that's ever been done, you start, and it's all online, you start to make people believe in this. And the other thing that's changed in my lifetime is serotonin. Serotonin, when I was training, they told us serotonin theory of depression and anxiety. If you're not enough serotonin, you need to top it up. Serotonin is only found in the central nervous system. Maybe a bit in your gut, like only 5% or something, right? And then later on in life, somewhere a few years ago, not that long ago, about 10, maybe not even 10, maybe 5 years ago, they started to say, oh, actually, there's more in your gut than you know. Maybe there's about 50% is in your gut. That's why the therapy works for, antidepressants work for gut, for irritable bowel. In fact, it works better than it does for depression. Not many people realize this, but the numbers are that it's like number needed to treat for irritable bowel syndrome for
using antidepressants for irritable bowel syndrome.
Yes. So it's for antidepressants. Yeah, it's 3. So it's not antidepressants, serotonin reuptake inhibitors, SSRIs, selective serotonin reuptake inhibitors, standard antidepressants that we give these days, not the old ones that we used to give. So SSRIs, they are number needed to treat is 3. It's the same as Imodium for diarrhea. It's the same as Fibrogel for constipation, predominant IBS. Same numbers, which is to us the number needed to treat of 3 is massive. It's huge, and it's certainly it's more than for depression anyway. So I mean less than for depression, but so more effective than for depression. And then recently, what do we know? Serotonin is hardly in your brain. It's mainly in your gut. And so how are these drugs working? Because they do work. They do have an effect. And despite what everyone says, mild and moderate depression, they say it's no better than placebo. But if you've ever treated depression, you know that something happens. And the question is it happening to your gut that's causing it that has an influence on your brain, or your brain that's influencing your gut? I don't understand, because the majority of the serotonin is in your gut. So what's happening there? So surely, and it's not complicated from there to say that if you eat crap, you feel like crap. So, I mean, so the thing is to use the same language and mean the same thing. I was using the example of Candida, where it's gone out of vogue, which is great, because during that time, it set our backs up a lot. When people said, yeah, Candida in the gut, can you go and test for it? The tests never come back with Candida. They can tell you, because we don't, first of all, it shouldn't be in your gut. And the test that we have, or if you smear it on, it doesn't, that's not what it shows. It shows, you get coliforms in your gut. So we can order gut microscopy culture and sensitivities, which tells you if there's an overgrowth of the most common thing we see is Campylobacter, but then it has to be diarrhea. So labs won't process anything that's not liquid. You can't just send it to the lab. So it's liquid and it's diarrheal. They will process it. And then rarer things, they'll look for rarer things like cysts and parasites if you've been overseas, and they'll look for things like C. diff toxin if you've been on antibiotics recently. I think nowadays they do it as a standard, actually. So
my question in a reversal would be: is there anything we should definitely not do when communicating with GPs?
So don't demand tests. Like, don't say, please do this, please do that, because no one likes taking orders, and I'm sure it's the same with you guys. If we were to write, do this, do that, you say, well, I haven't assessed the person yet. How do I know if that's the right thing? It's like, so we don't like to be told what to do like anyone else. It's just human nature. But what you could do is say something like, this person's getting a lot of cramps that we can't explain. Perhaps it's to do with the fact that he's on a proton pump inhibitor long term. and maybe their magnesium levels are low, would it be? Do you think it might be worthwhile checking these levels or stopping the proton pump inhibitor and taking supplements? So you've given them a choice. So they can either test it, which is the easiest thing to do, right? Or they can just stop the drugs, which is very difficult to do, and then they're not going to succeed. And doctors know that, so they're not going to even bother to try often. We try all the time, but because the prescribing people tell us to try this, and we know it's not a good thing. You know, at one point and I mean, in fact, it still is the most prescribed drug in the world, or statins, but then second ones are proton pump inhibitors. And so, and now we realize that, you know, it's dropping lots of the other nutrients. I don't know. I'm sure you guys know more things. You know, so what we see these days is magnesium and zinc are certainly very low, and I don't know what other. And it must be causing huge amounts of imbalance in the gut. Because
yeah. I mean, usually we will always look to heal the gut, as I was saying. As you know, if you know, obviously myself, I'm a nutritional therapist, but if you were talking to a naturopath or a herbalist, I'm sure their answer would be, you know, more or less similar, but they have their own remedies and suggestions and protocols for someone on that type of medication.
So like give them a choice, be polite, say I have concerns over this, and then if this person's this because of this, do you think you could do this or this? If not, what do you suggest? And you can, you know, give them a choice, I would say.
Yeah.
And the other thing is, you don't always expect them to reply, you know, but if they can get your patient to communicate with the GP, because the GP, you know, they say, are you happy with that? And they go, well, okay, you know, and usually they'll say, well, I don't know what they're doing, but usually it doesn't do any harm. And that's the main thing. What we want to know is that whatever treatment you're going to give or anyone else gives is not going to interfere with the treatment we're giving. It's not just the UK, it's worldwide, I think. Nutrition, we were just talking about this, so nutrition from our conference last year was the first time. Lots of people were interested in it, lots of doctors. So we got half of the people who attended were doctors, half of them complementary therapists. And if you come this year, that'll be great. And if you guys could come, you'll meet a lot of doctors. We've got doctors this year coming from the Mayo Clinic in America. They'll come flying over to attend the conference. It'll be really interesting. You know, they'll come. The hospital's paying for them to come to see what it's about. So anyway, they were really interested in nutrition. There's this massive. They call it lifestyle medicine now in the UK, and we're getting some talks by them. And we're having a spinal surgeon, an orthopedic surgeon. So orthopedic surgeons are usually not interested in anything to do with anything other than their bones and operating and hammers and drills and DIY tools. So this guy is coming to talk about lifestyle medicine and diet, you know, because it's changed the way he's practiced. And we can see this, and this is massive interest in doctors because we know that this is important, but we just don't have the knowledge. And if we could work with people like you who are constantly keeping up to date with the latest research, and if we could combine forces and interpret the data, and I know certainly some nutritional therapists coming to speak to us, and I've said the other thing that you guys can do is speak to the universities and the medical schools and start saying, you know, what are you teaching your students on nutrition? And the answer is usually nothing. And then they'll say that we don't have enough money to teach them nutrition in their core curriculum, which is fine. But what they're allowed to do is they're encouraged to do something called special study modules, special study units, right? It's part of the medical school curriculum, and it's where they slot in additional things like complementary therapy, nutritional therapy, anything else, any peripheral things. And people can choose these things, and these things are very popular. I have one in hypnosis, I have one in acupuncture, always fully subscribed. Everyone finds it fascinating. They want to know more about it. They want to, because they know it's important. You know, there's nowhere in the news, like we were talking about today, I've had at least 3 people come in to talk about diet and how they can prevent things from happening to them. You know, one chap was thin, but he wasn't really thin because he had visceral fat. He had a bit large fat around his abdomen. So and he didn't really do any exercise. He had an okay diet. It wasn't great. You know, and so we we had to talk to him about that. People are interested, and then people come in and ask. The in thing, like I was saying, is the keto diet now. Everyone's asking about this keto diet, but keto diet has been around since what, 20s, and we know it works well for epilepsy.
Mm.
Some trials, that's what we designed it for, and in some trials, better than drugs, or as good as drugs in some trials, which is crazy, right?
It
So
works in quite a few mechanisms in the body, a keto diet, I think.
yes, but then long term, and then we know it works for diabetes because one of my patients, he knocked his HbA1c down. I don't know if you know the numbers, but normally 53 is the threshold of well, 48 is anything 48 and above is diabetes. This chap was 105. He went down in 2 months to 55. I just got a result yesterday by following the keto diet. And we know the evidence is there that it responds really well in the short term. Many diets are short term, not necessarily long term. It's a change in lifestyle that makes something long term. And who knows, the keto diet could be a lifestyle because it's easy to adhere to, maybe, or usually not. Because what people find is they have what they call the keto flu and things like that, where they feel crappy. So diets like that, I don't know how sustainable they are. And then long-term wise, if we were talking about outcome data, which is what doctors like to hear about, does anyone actually live longer? Do they have less heart attacks, less strokes? And you might, and I know this whole thing with evidence, it's not there yet, but it's getting there, and there's this explosion of data. I mean, certainly what a great book is a book on meditation by Daniel Goleman, who wrote Emotional Intelligence. He wrote a book called Altered Traits recently. Strangely not a bestseller, because everything else he writes is a bestseller. But what it shows is the journey of mindfulness, of meditation, from the 70s and John Kabat-Zinn, and them just starting it out, and then growing and growing and growing until now. Everyone goes, oh, just, in the past you used to feel ashamed when you go, oh, maybe you should try some meditation. And they go, oh, you're only saying it to me because you're from the East, right? But now everyone says it. It took a few people to start doing the research. It took a few people to start doing it and sharing it. And I think nutrition will be one of those forefronts. And we may say, I think we were talking, we have a feeling that the body will take what it needs, and you may not. And I think we have this chronic problem of overeating. And I don't think I'm alone in that. I think we all know this. And politically, I know it's very difficult because the food industry is doing really well. I know this because my personal shares in the food industry have skyrocketed. And I know it's doing really well, and the government can't afford to say things like that. At the same time, they need to tackle it. And they do talk about the sugar tax, and the sooner the better, because it's too easy to get a hold of. Everyone's getting bigger and fatter. And so one day, as this is building, this is where I see nutrition going. So and then to make it go, to progress it, I think we need to work with nutritional therapists, need to fund research. Nutritional organizations need to fund research. Maybe work better with places like Diabetes UK. But guess who funds Diabetes UK? Insulin companies and drug companies. So, but at some stage, someone's going to. Lots of the charities have money and have funding for research. Certainly MS, there's lots of people are looking into that. They've got, and same with nutrition. Once you've had good nutrition, once you have more energy, and once you're fitter and thinner and trimmer, there's no going back. And I think the industry, I think the society and the public will take it forwards more than for food, certainly before us. For example, what's happened with lactose intolerance. The lactose-free range started, and I knew lactose-free when it came on was going to be a success, because 95% of my people from Southeast Asia are lactose intolerant. And if you believe that I am so different from the people in England and Caucasians, then I don't believe I'm that different. And even if 5 to 10% of the population is lactose intolerant, 5 to 10% is a lot of people. And so, as you know, even Lidl and Aldi are stocking lactose-free products. So this thing is a real problem that no one had detected before. And medicine is so much, I mean, we've gone off even checking for lactose intolerance now. We just go, the labs say we're not going to process it because they can just go and buy some lactose-free, have a pint of real milk, have a pint of lactose-free milk. One gives you diarrhea and one doesn't.
It's true. It's
So
true.
I say, why waste £100 on a test? Because you can get it over the counter. And then the other thing that's bursting in now as a GP, I can see is kefir, sold in every major supermarket, not quite into Lidl and Aldi yet, sometimes, but
But
not
in
there
the
yet.
major supermarkets, you are finding kefir very available,
Yes,
as available in all the supermarkets and the health stores as well.
and my patients are coming to tell me that it's good for them. And it's starting to be so much of a movement that there's very little that we can do. And I think that's where we need to know more about it. And I don't, people are teaching me, but I would rather have someone like you come in and say, maybe there's something you don't know about that I know that you don't know about, because I spent 3 years of my life studying about this subject, whereas you spent 3 years of your life studying about everything else. And so it's about sharing knowledge. That is what I'd love to see.